Choosing to become a doctor or medical professional was one of the biggest decisions of your life. Now that you're approaching the end of school, your career is starting to come into focus. It is a time to be introspective. What kind of provider do you want to be? What setting is the right fit for you? What would it feel like to be there?
When I did my interview, I was really struck by how passionate everyone was about talking about how to change the system and how to better serve our really vulnerable patients. And just like the overwhelming friendliness of the place. It felt very kind, warm, compassionate. All the residents and the faculty were very inviting and friendly, and that's what I wanted from a place that I was going to spend 4 years.
I remember a lovely experience that brought me to want to come to CHA even before I was really here. I got to attend one of the minority trainee dinners. So it was almost entirely Black, Indigenous, people of color residents in a room together, sharing dinner, sharing laughter, sharing really politicized, important conversation. And I was just in love with the level of care and joy and compassion in the space. I'm like, wow, this is a place that I want to build community in.
I decided that I wanted to come to CHA after my interview day. I just was so impressed by the warmth of everyone involved in the program. And I just realized, like, this is a place that will value me as a person and not just like a worker. I just got good vibes.
You know, I do feel like I have a pretty reasonable work-life balance here compared to my colleagues at other institutions or, you know, in other specialties at other places. I think it's something that a lot of people at CHA recognize, is that you're not going to be a good doctor if you're miserable and if you're kind of working all the time.
I have family. I have 2 kids and wife. So my situation is a little bit different than other residents. This residency community is very understanding of these family situations. And whenever these kind of things happen, they're very supportive. So that gives me a peace of mind when some troubles happen and some unexpected things comes up, that I can really talk to our residency like leadership, chief resident, and I have that trust that they will support me.
I have time to be friends with my co-residents outside of the classroom. I have really just been able to focus on other things that bring me happiness outside of the clinical work, which also brings me a lot of happiness.
One thing that I love about this program is that in many ways it is a bit of choose your own adventure. There's a lot of space and opportunity to do the things that you're really passionate about. Because it's a community that highlights that, while you can do whatever you want, you have access to incredible amounts of research and opportunities through the larger Harvard network. There is this focus, this energy around social justice work. And I think that creates a lot of opportunity for collaboration, for new ideas, for trying things that I wouldn't have been able to try in other places with perhaps more established, larger institutions.
I think what it came down to for me was that CHA had a pretty unique mix of service to the community, of working with underserved populations, but also kind of academic rigor and academic bent. And there aren't a lot of places like this where you have both an academic affiliation and kind of research going on, especially research focused on health disparities and the health of populations, and then also a real community focus and really kind of a place that's a little bit smaller, a little bit friendlier.
I love Cambridge as a city to live in. It's like a super progressive city. It's very beautiful. There are so many trees. I sometimes like going for walks and we'll discover new neighborhoods. CHA is a place where you can easily live walking distance, and that's really nice.
You know, I think this area is particularly nice because it's got the feel of a city and it's pretty dense, but it doesn't feel as kind of crowded as maybe like downtown Boston or, you know, kind of some other like bigger cities. So it kind of has a nice mix of being close to things, being accessible by public transit, but also feeling a little bit less crowded.
A vibrant academic community with research opportunities, hands-on clinical experience with diverse communities, the ability to achieve your professional goals, and work-life balance. If that's what you're looking for, then CHA is the right match for you.